I still see patients, and like the South, they don't have any place to get some food, but I still see people staying 3 to 4 hours waiting for the bus or the mass transit. So I don't know where our MUO with mass transit is, but maybe we should relook into it and ensure that there's a number that we can call, the clinic can call, and that they can have somebody from mass transit come and pick up the patients so that they don't wait there 3 to 4 hours.
Mass transit doesn't come like once every hour?
Nope. Not
Because
downtown.
in the north, every hour on the 20th,
Not
120, 220, 320, they're always.
Well, that's why we need to look at our MUO.
Yeah.
Because I don't know what it says.
Twice a day.
Yeah.
Once in the morning or once in the afternoon.
Okay, we'll check with mass transit.
Yeah, I mean, maybe just like I said, relook at our MUO with them to
Okay.
see what we're supposed to do. Because like I said, I remember seeing a patient's family, and a bunch of little kids at 1:30, and when I left at 5:30, they were still waiting for the bus. And there's no, like I said, there's no places to eat. You got a bunch of kids, what are they gonna do? Run around, they're gonna be running around the parking lot, so they're waiting for soup to happen.
So one of the things to talk with the EHR is that we now have a capacity for telehealth. So that's one of the things that we're going to bring up with CMS, so that can be reimbursed by Medicaid. So that's gonna help also with the access part for the patients.
No, but still, we need to look at that mass transit, because like I said,
Yes,
some of these you can't do telemed for school physicals,
yeah.
That's
so
true.
that's what.
Because they
they're
can't get
there
their immunizations for
Yes.
telemed.
Yeah.
But yeah, for those who can.
Okay.
So patient volume increased actually from increased 21.7% from May to June, and new patient registrations also increased. So I mentioned earlier the Northern clinic renovation is gonna start Monday.
Sorry. The recommendation from the last month's board meeting you were out is so that we can have an actual comparison if we do have an increase or the decrease in patient is side by side the same month
But the year
In
before.
2025.
in 2025 and 2026. So we will be able to identify, okay, what are the potential issues that on the same month last year, we have higher number versus this month this year. Okay, thank you.
For the strategic initiatives, we're completing the next gen transition. We're trying to complete the Medicare enrollment. We're trying to strengthen revenue cycle performance. We actually submitted two grant applications, one for telehealth nutrition services, and this is a 300,000 grant award annually. And for the ECCS seed, early childhood coordination services, we were in collaboration with Cedars. This is an 875,000 annual grant for 4 years. For the telehealth, that's a grant for 3 years. So those are what we applied for. There's again a small grant for TB, that's 12,000. We're going to submit that next week. And there are 2 other upcoming grants. And again, it was mentioned earlier by Dr. Bob, when we write those grants, the folks who are going to be, the staff are going to be in charge of the grants are written into it, and we have the positions available, open. Right now, we only have Darlene and Deb as program coordinators. Abe retired and Zita transferred to another agency. So that's why we're yeah.
Do we have the money to fill those positions? Because those are important.
Yes,
Because they're the
very
ones that
important.
manage these things and make sure that once we get when we're approved, As a matter of fact, we're still on SAC grant right now and behavioral health grant. We wanna make sure that they're using the money, because we know that when the invoices go to Department of Administration, they're charging everything to program income and not
Right.
tapping into the grants, right? And that's why our income goes down really quick, because they haven't taken what they were supposed to be charged to the grant from the grant money, right? So we wanna make sure that our program, that we have those people in those positions to make sure that that's coordinated with DOA, right?
So we also wrote them into the grant application, yes, the
Yeah.
positions.
Yeah, okay,
To be
Can
in the
I ask
grant,
a question?
yes.
DOA staff to be in the grant.
No, so our staff,
Our
yeah.
Oh.
The grant
For the
is
program
funding them,
coordinators.
is
Oh, yes.
funding their positions.
So-
Okay,
okay,
Ron,
go
go
ahead.
ahead. Go ahead,
Mr. Ron first.
My question is this. We lost 2 positions, one retired out, one transferred out. The funding, where were they getting paid from?
Program income,
Okay, so that actually came from us.
yes.
Did we have, so their salaries were already set. Did we have a budget for their salaries already set for the year?
Yes.
Have we filled those positions?
Nope.
What is the reason for not filling those positions?
A lot of the reasons are that we need to send the allotment, right, to.
So
to
Mr.
FM.
Ron, different from a budget that's locally
Mm,
assigned, right? So that's already set. But we are working with program income, and actually when we submit our the funding source for the people that we hire, it is based on projection. It's a projection income. We don't have it.
We don't have the cash on hand
Yes.
when we hired them, Mr. Ron. So what happened is, so we're just leveraging on our program income monthly. So when they left, they retired, they resigned, we have to redirect the assigned funding for them for projects like renovations. We have to pay our obligation with DOA. So those are the things. So it's only always projected. But for those, especially for the healthcare providers, they're funded under the federal grants.
Mm.
Yeah, but yeah, and then for those that, because we also have a limit on how many healthcare providers and nursing staff or CHC staff that we can that can be funded under the federal grants. So that's also what's restricting us. And to add to Madam Chair's issue regarding DOA, we had met with them. I joined the team when our CEO is on leave in June 22. So they have a new supervisor who joined the team's meeting, and to prevent to ensure that the expenditures are properly charged to the our account, federal versus program income. We will be providing them, because I just found out when every time we ask for how much is our 105 funding, we never even provide them our expenditure or our list of this is what we have received. So this should be our net program income that we should be receiving. This is our expenditure listing each and every grant account that this expenditure should be charged. So there should be check and balance. So moving forward, that will be starting this June request. We should be sending that list to them this week. So it's going to be every second week of the following month. We will request for our month program income with a projected net, depending on when DOA will pay our obligations or our expenditures. So more or less, we will have a real estimated program income for the month. So because they also found out that I think they were only looking that they think that to the 105 in the account number is strictly federal.
Federal.
Yes, but our program income is also 105. So that I think where the mix was previously when we sat down, when the Sherma sat down with them last year. Yes.
Can I make a statement? And I can see Mr. Mino's frustration. I want to make this clear. When I joined this organization, we had $6 million. Am I right? I haven't been a member very long. It's only been 3 years. We're broke. Something is wrong. Something is definitely wrong. I can see, and Mr. Mena, I commend him because he really speaks out. Sometimes he can probably get a little too much, but that's his, I can see his heart for the program. I can see his heart for the clinic. And I myself, I can understand why 6 million. I'm not blaming anyone here. Don't get me wrong. I think we need to find out what has changed because from what I understand, Mr. Meno, this was also a very profitable organization. What changed when this admin took over? What is it we're doing different with them? Mr. Peter John, you need to look into this because you're part of this. I get confused because I see employees here. I don't know if they work for the public health or the health center, but
It's the same department, sir.
okay,
It's
so
the
but
same
we're
department.
paying. Where's the money coming from? It's coming from us to pay them.
Understood, but
Right.
it's still under the Department
We
of
are
Public
still
Health
under
and Social
Department.
Services.
Okay, so why is it we're having a hard time maintaining a budget?
And I will offer this thought, sir, that the previous financial arrangement that the community health centers had wasn't the best. If I come to a meeting and I come to the meetings rarely, and I ask the accountant who's assigned here, what's our balance? And I can't get an answer, something's wrong there.
Okay,
I don't have that answer.
Can I say something? Since we are part of public health, why don't you assign someone to assist us?
Because somebody had made an arrangement that they were going to go to a different external
Can we change
agency.
that? Can we change that?
I just want
That's a
clarification.
recommendation. That's a recommendation we've made to the community health centers.
Okay.
Get out of that one. Go somewhere else.
I just
If you
want
have to pay
clarification.
for it,
I'm
yeah.
new here, sir, and I'm
Yeah.
not blaming you.
No,
I'm
no,
just
no.
wondering
I-
why things have changed. I've not been here long, but I'm surprised because it went from a money making. I mean, people get sick. They're always going to get sick, so there's always money to be made, right? I mean, I get sick. Yeah, there's a lot of competition now, but we have services that are not available in some clinics. Why is it we're struggling? You know, being a businessman, I can tell you when a company has a special niche, they can make money because nobody else provides it. People need it, but it seems like I feel like money is not going our way. I feel like we're in a sinking ship. Can you imagine 6 million in 3 years? I've been here about 3 years. We had 6 million, and then when I started, they said, "Oh no, that's you. You have 6 million." Then we find out, oh, you don't have 6 million. Now, admin side says we have money. We're already saying we don't have money. We need to make money to pay for our medical supplies. Is admin aware of our situation? If you are, you keep saying, your boss comes in, she says, "I'll help you." I see struggling. I really do. I'm going to speak as an outsider, not as a board member. I feel sorry for her, like, Doc, crying out for help. We're crying out for help.
And I hear
Sir?
his cries.
If it's election time, I think maybe we should make a statement. Hey, people on YouTube, be aware what's going on. We have people here coming, taking the time to make this medical center for the people of Guam. Why are we being denied help? We need help. If you know us, Hey, share this video because it's going online. I have my friends online. They're gonna share it. It's election year. I'm sorry. It's election year. Wake up, everybody. I can see why people are switching parties. That's all I'm gonna say. We need help. People out there, you can help us on YouTube, please. Make it aware. Public health, the clinic needs help. We're struggling. We're here to serve the people of Guam. We're not here to rip you off. You have people like Mr. Mino. I commend you, Mr. Mino.
That's our
Okay.
job.
Can we
Yeah.
go ahead and move on and stay
Okay,
with the
that's all.
agenda? Okay, and I'll share it with you, Ron. As a board member, it's our job to also, we have the providers. We're one of the fewest clinics that have an OBGYN.
Yes.
Our patients are not coming until they're in their third trimester or ready to deliver. Okay? When patients come to us, we make money. We have internal medicine doctors. We have pediatricians. We have behavioral health people. We have a laboratory. We have a pharmacy. But are people coming to use it? Do you all use it? I use it. Do you all use it? We need to bring patients. Okay? But that's where our program income comes from, is with the patients. Our providers are here, but are we using it? Okay, are we promoting the health center, or do we just come once a month to these meetings? How much are you promoting the health center, the use of the health center? Okay, because the more people that use the health center, the more money we have. The reason why our funding has gone down, because we are fronting a lot of the repairs that need to get done. We have to get supplies, and yes, we have a problem with supplies. You've heard it here, because we are government. We are
Right.
still a co-applicant for our grants. We are a co-applicant with the Department of Public Health. We are still under the Department of Public Health. Remember, it's going to take us several years. They're giving us up to 6 years to completely sever as autonomous, right? Okay? But we can't just do it by coming once a month. We need to be active every day. You know? This is the thing, is we're fronting money to pay for the utilities. You know, we pay 60% of the utilities over at the Northern Health Center. At the South, we're paying 100% because we use the whole first floor and just a room in the top. But that funding is coming from our program income also. Okay. Yes, we have grants, but grants are very minimal compared to what we have in our program income. Our program income is a bulk. This Medicare problem that we've had for the last 3 years, you know, we're losing out. We're still seeing Medicare patients, but we're not collecting from them. That is where we're having a problem. In the past, we've
Is it
collected from
because of
them.
the policy change?
No, it's because, you know, unfortunately, somebody along the line dropped the ball in the application renewal. So every year we're losing at least $30,000 a year from Medicare patients, and we're not going to go back. We can't back invoice that. Okay, so that's how much we're losing. That's why we're losing money. But continue to advocate for the health center. Continue to advocate for the use of the health center, not just coming once a month. Okay? Because we advocate as board members, we advocate every day.
So how much like do we advocate? Do we advocate through the mayor and on the entire island?
We have 3 mayors.
You
in this.
mentioned advocate.
We tell people in our community
I do tell
to
people
come
in
and
the
use our
community.
health center.
I am one of that person that go to public health constantly, like you and me.
I
Okay?
just want to commend you guys, your efforts, Charmin, Katz, and the team. I gotta say, before you guys came, these advertisements, these social media outlets, we're on the right track. We're moving forward,
Yeah.
and I just want to say we're in the direction that we're going. I think it's great, and the word is getting out there. It's just a matter of changing people's concept of where they feel comfortable. And Madam Chair, also reminder about the OBGYN, very important. And we have a lot of that, but your efforts, nevertheless, all these things prior to what we have, the social media, It's great. Everything that you guys put out, we share it in all our chats. So, of course, it's my opinion. It's gonna eventually come to fruition sooner or later because we are spreading the word. We are all advocating. But thank you guys.
I just wanted to say something, if that's okay. Madam Chair?
Yes,
Okay.
Dr. Bob?
Okay, so before my time, Ron was right. They were making money. And that was because we had strong administrators, CPHO and CO. I think one of the reasons why we are not making so much money up until this point was we didn't have a CEO. We didn't have a CPHO to get the contracts signed so that we can start doing some of the stuff that we're supposed to be doing. And I think we're starting to, Mayor said, we're starting to see the fruition. No English word. But we're starting to see that fruition there
Yeah.
of our actions. We're starting to see more payments being made to the clinic. And we're starting to see more money in the
Program income.
program income because of that. Up until the time there was no CEO or CPHO, we were just floating.
Yes.
And we weren't, that's where I think because of the strong leadership that these guys have shown, that we're starting to turn it around. But usually when you turn it around, you're gonna go down more before you start climbing up. But I think when I do my report, I'm gonna mention some of this stuff that we're trying to do to make more money. But I think just because of the two that we have here, we're starting to see it turn around. But you're right. Before 2017, the CHCs were making about 2 to 3 million a year. And that's making money after paying off their obligations. But because we lost a CEO, lost CPHO, some of these programs that needed attention weren't getting attention.
And a lot of holdback was, like you said, Dr. Bob, our contracts and all these things that we need to do, expansions, contracts for providers, had to go through the Attorney General's office and sat for months before we could see anything. Sometimes months, and we kept having to ask for extension through HRSA, remember? Extension through other contracts. And when one contract sat for a long time, we had to, it affected others. Appointments that were being made. So, it's just a domino effect.
That's why
from
now,
one
Madam
thing.
Chair, excuse me, Madam Chair, we because we are public health, we should go directly to the director. You just said that we're under public health.
Yes, sir.
The director has the right to talk to you mentioned the AD. So is the governor, so is the legislature. Okay? It's their responsibility to help us, come in and help us. Am I saying it wrong?
No, you're
Not at all.
correct.
Not at all.
Right. We need your help also. That's why I asked you about the funding and the change. You mentioned something that we need to change because we make a wrong decision. Then we gotta change that.
All right, so let's go ahead and move on. Yes.
I want to commend these two leaders. We appreciate you. Don't get me wrong. You guys are working in a tough situation. You actually walked into a situation where most people will probably just give up. But thank you for your service. I don't want to come off that.
They're not in that.
They're not hurt, but they're trying. They're trying their best. Caps, Sharma, thank you for your service. I don't want to make you feel, oh, Mr. Steele is telling me. No, I'm not. But thank you. I may come off very abrasive. That's why I try to not say much. Ray knows that. Ray knows that about me. Yeah.
Okay, all right. Thank you so much. We'll go ahead and move on.
I just like to say thank you to the board. We're not onion skin.
Yes.
We will take it. Well, you can be as honest as you need to be. We take it. We will.
I still have question for you,
Yeah, yes. Sir.
CEO, Madam
Yes, sir.
Chair, on this position. Are you aware that these people are leaving their post, their position?
Yes, sir. Yes, sir.
Why didn't you prepare ahead of time?
So, sir, the biggest factor right now is the
Yeah.
budget.
Because you cannot just resign right there and get out. I quit.
Yes. So they would inform us ahead of time if they're going to be promoted, if they're going to resign, if they're going to be retiring. Yes, sir.
What's the time frame to resign? 60 days?
They usually
Depends.
give us it's different times, but they give us ample time.
Yes,
Yes.
it depends.
Yeah.
It's just
Nobody's
Because,
surprised.
because you know, look where we are now.
Yes.
We are gonna hurt because of this position. And I hope that you understand where I'm coming from.
Yes, sir. Understood, sir.
And Mr. Meno, if I may add, for government of Guam, we cannot hire immediately a replacement until the body
I am aware of that.
is.
Yes, I am very much aware of that.
Thank you.
Okay, so we'll move on for the quality improvement report. So the CHC actually is in collaboration with APCHO, along with other CHCs in the Pacific. So APCHO is supporting us with our project for the diabetes and tuberculosis. So people with diabetes actually have a higher risk of progressing from TB infection to active TB disease. And so we're making sure that our TB patients who have uncontrolled diabetes with A1C more than 9%, that we're testing them at least annually. So that when we can catch early, should they have diabetes. So we've started this project this week. Lian is actually part of the group, and we are again receiving the small grant for efforts. There's a $2,000 that APCHO is going to give us for quality improvement, and another $12,000 that we're going to use to purchase Bucky for the X-ray. So PB program generously offered for us to use their chest X-ray machine.
X-ray machine.
X-ray machine. And we just have to purchase a 4,000 trolley for us to be able to use it. We have the room in the laboratory. They will have their technician assist us when we have a patient who needs an X-ray, and then we have an MOU with MDX and
For reading.
for reading of the weight. So that's one thing that we're looking forward to. We now also are working on health and wellness assessment. This is really the behavioral health screening. We have been doing the PHQ-2 screening for a long time now, but we're also we're adding some more assessments for depression, anxiety, alcohol, and we're not only screening the adults, but also the adolescents. So we have tools, the PHQ-2, GAD, Audit C. We have translated actually the assessments already. We have a Chuki speaking staff, and this also went out to the members of the Chukis community for them to confirm. So I learned that the Chukis dialect is yes.
Okay, so can you make sure for clarification?
Yes.
The lagoon understands the outer islands, or the outer islands
Outer
understands
islands.
the lagoon? Understands the lagoon. Okay, so you need to make it in
Yes.
lagoon, because the lagoon dialect, because
More,
they
yeah.
they understand both sides.
So it
Okay.
actually went out to our staff and to the Chukis community.
But are they from outer island or the lagoon? Because it makes a difference. Because I remember public health years ago did the outer islands,
Yeah.
translation, and the people in the lagoon couldn't understand.
Mm.
So we need to make sure that they do the lagoon, because the outer islands understand, okay?
Madam Chair, if I may add, because it was shared with me with our acting health services administrator from Bureau of Non-Communicable Disease, that it's better that when we do an ad, it's a video rather than a
Really?
pamphlet,
Yeah.
because it's very difficult for Chukis to
Read,
translate
yeah.
it. So if they hear it, it's either a video or an audio. If they hear it, the translation is better, that you are communicating what the intent of the message is, right? And if our board member can
Elaborate.
concur on that, right? Rather
true?
than,
It's
because
better
we
to
have the
do
write up,
Yeah.
rather than we
That's-
translate it in writing.
Yeah, because there are also some people that are not able to
Read.
read and write.
Yes.
But they can hear and understand.
Yes.
If I may ask, Madam Chair, her directly to you, do you call a meeting to inform them?
Yes.
Good.
But
I,
It's not
I
everybody.
hope and pray that you do that.
Yes.
But you're the representative on this board, so they can know and understand our program. Do you have brochures to issue out and paper, whatever it is, that they need to know?
By
That's what
word
they're
and
talking
verbal.
about.
Yes.
That's what they're talking about, the
Uh,
brochures.
The
they don't
brochure
really-
wouldn't work, Mr. Meno.
They're trying to get more verbal and,
Why do they have different language than
Yes.
what?
yes.
Yes, they do.
Oh, okay.
Yes, that's what we've been talking about, Mr. Meno.
Yeah.
So one of the things, Jan, and I know it works better when they do the faith base, when they go to the different churches.
Yeah.
Because they don't go to the same schools, they don't go to the same parties, but they all go to different denominations of faith. So when you do those announcements in the faith-based organizations, then they understand it, they bring it home, because it's coming from their churches and their pastors, right?
Yes.
So that's how they're doing it, we're getting the message.
Discontinued.
Yeah, but you can tell them at a party, they won't understand. But if you tell them at their churches, all denominations, they understand it, they bring it home.
Yeah.
Yeah, where is it trusted information, right? Yeah. And so you're working with them, right?
Correct.
Okay. Thank you.
Good job.
So in the CHC efforts to integrate behavioral health and primary care, we actually found out that patient needs help with medication adherence, lifestyle changes, grief, depression, anxiety, and family-centered concerns. What's good with the community health center when we see these patients are that the families often present together. So because we're the community health center, we serve people from their childhood to adulthood, and in our logo, it's their families to communities. They actually come together, and that is a strength because it creates an opportunity for coordinated, family-centered behavior support. Right now, language access language access is important for our patients who use English as second language. That remains a barrier, and we still need provider support and trust in our workflow. Most of our warm handoffs are coming from one provider, but we're hoping now that we're going to do the workflow and we have the appropriate screening. Once we roll it out, there will be more referrals. So I just want us to, on page 7, just make sure we keep an eye on the bill 30838. This is regarding supervision experience in Guam for our psychologists who are in training. So right now, our psychology associate that's assigned to the CHC is removed from the community health center. I have yet to get information from Guam Behavioral, what is the plan moving forward, but we really need that help. We only have Dr. Maney in the community health center, and we're going to rule out the health and wellness assessment project. So we're expecting more referrals and more patients who will be needing that support with regards to behavioral health. So we really support, well, we support the Bill 30838 in as much as they're trying to establish a pathway for proper supervision. But this might affect the ability of the community health center to provide behavioral health services and develop and retain psychology, the psychology workforce. So just keep an eye on it. So for the medical director's report.
Okay, go ahead, Dr. Barr.
I'll go over the non-controversial stuff first. So, Dr. Duenas, who we hired full-time, unfortunately cannot work as of yet because of family medical. He was here, he was gonna try to get the drug testing and then go back and help his family during their time of crisis, but he was told that if he gets the drug testing, he had to be working, and he couldn't work because, like I said, he won't be able to come and give his full time until the month of September. So Dr. Duenas is still on hold as a result. Our other hires, Dr. Lee is increasing her hours. She's adding 4 more hours a week. And like I said, she actually wants to do full time, but because of family, she can't do that. But she's slowly, as she can find time, she's slowly adding hours. Dr. Billing, our OBGYN, also is adding more hours. So he's adding 4 more hours per week, mainly in the south.
Patients coming?
Yes.
That's what I was gonna get at.
Okay.
Okay, so yes, we're seeing more people coming, more females coming in for pregnancy and other issues. Like I said, before we hired these guys, we were backlogged with our colposcopies. Now
you're
we
up to
have no
date.
problem. And I was trying to see how we can maybe get all these organizations that deal with female health, maybe have a small invite, say, this is what we have to offer.
Yeah.
We can do these things. We're like Dr. Mayor brought up, we're one of the unique clinics in that we have an OBGYN, we have a family practice, we have a certified nurse midwife, and a nurse practitioner that are able to do female health, but we're not taking full advantage. We are seeing more patients coming in, so that's good. What I'm gonna ask Dr. Lee Tasker to do is see that there's some grants that we can help offset the payments for our providers with the female health grants, and we can also use the mobile unit. One of the ideas was to, I hear that they're talking about doing this birth control at the hospital in the OR and that's at a high cost. Whereas Dr. Lee says that she can actually do those things in the mobile clinic at a much cheaper rate. And since if we have that grant, it can offset some of the money that we pay for her. So I'm gonna task her to try to look into some of these grants that can help offset so that the CHC program income won't be tasked, but these other female health grants.
What's your recommendation
For,
to improve our community health center? You mentioned a lot of things.
okay, so if I understand what you're asking me, one, we're gonna be trying to get
To
some,
bring more people.
right, but we need to, so first of all, I think the ones that we have now, they can, like I said, Dr. Lee can start doing some grant applications for the female health. And
No,
that-
what I'm asking you, Doc, Madam Chair, if I may, member of the board, what I am asking you, you mentioned something that we the different doctors provider. How can we motivate people to come to us, to our clinic?
I think they're actually starting to do.
They are coming now.
I've noticed that.
You mentioned that already.
Yeah, I
Well,
noticed
what
that,
is your, I'm asking you, what is your recommendation?
I think to continue,
Para na may gay.
Just
I think they
advertise
continue
word
it,
of mouth.
and then, have the mayors, like, right, this Saturday, we're having in reach for school physicals up in the north. Maybe we can ask, the mayor of Dedido and even,
Can you go to the registration, Ray Gibson, and talk about it?
But the people that need to come are not listening to the radio, that's the
Yeah.
problem.
and they also don't have.
What about the TV?
They don't have.
watch TV either.
They don't watch TV, they don't listen to the.
They're always on their phone now, you know.
So I think what we could do is like Jan, and we can announce it, do it in church announcements, different church organizations, announce it.
And then
because
we're
that's-
gonna be doing the South next week, so Mayor, if you can just,
I give a recommendation, try to contact the school nurses. My son is a school nurse for San Sanchez. And socioeconomically, I think a lot of their students will qualify for the services.
no, we're taking all insurance except for one.
Okay,
I didn't say that. I was told it was a different reason, because they're federally approved and that they can't,
Nobody can
Can't,
take care.
can't,
There's a conflict.
they can't be a part of the,
Yes.
our
Conflict with
program.
our
But yeah,
Yeah.
but we take all insurance, and because we're gonna take we also got more supplies like immunizations. I was able to go to immunization program, and because there's an increase of pertussis, they were able to give us Tdap and DTaP, which is, one of the shots that are required, so that we can give to the patients that are not BFC qualified, so that they can then we can see other insurance as well.
Doc, if I may understand, so all our meds now and all our all in or not? What are we lacking right now? I believe we're talking.
So right
We're
now,
We're still low.
Still low?
we're still low, but already we have $200,000 worth of 340B
Oh,
medications that's been requisitioned.
But can insured patients use them?
No,
No.
but that's why, what I'm saying is that we were able to get from immunization programs, some of these needed vaccines
For those that are not.
that are not
immediate,
qualified.
for the immediate need, right?
Can we get to the school and give them a
Okay.
brochure? So they can know and better understand who we are and what is Guam is all about?
Yeah, the only problem is that they're not in school right now.
Okay, I do have because DOE has an outreach group organization. The social workers go out during the summertime.
Okay.
So we can give them that information and let them know where they're at. But the mayors should actually put it in their chats, their neighborhood watch
And then,
chats.
to Ron's point, then maybe we can also get a hold of all the school nurses.
That's DOE,
Yeah.
that's part of the DOE,
Okay.
Umbrella.
student support.
Yeah, okay.
Actually, we're seeing a lot more patients for women's health. We accept 2 walk-ins in the morning, 2
Three.
walk-ins in the afternoon
Three.
for the providers,
3.
and 3 for the nurses. So that's 5 walk-ins in the morning and 5 in the afternoon. But we're still having some patients that we're not able to see because our schedule is so full. We're full for the month of August. So we need, so we actually need the help of
And that's why
Dr.
it's good
Lee.
that they're also increasing their hours.
Yes, yes.
Dr.
That's
Bob,
very helpful.
Huh?
Sherma was saying we need the help of Dr.
Lee, Dr. Lee to see the women,
in the
the
north.
women in the north.
And like I said, she's adding more hours. And
Thank you.
Dr. Lee is one of the most, even though she's new, she's one of the most used
Yes.
physicians, because she's pulling in her
Yes.
private,
Yeah, her
That's right.
Because we're now-
private patients are coming over.
and the and we're, a lot of the private insurance patients are realizing that they can come to public health. Before they
That's
thought they
true,
weren't,
that's true.
that was
Yeah.
only for indigent.
They'll follow.
And also because a lot of women are using Toru.
Yeah,
There's a reason why,
Not very good.
but I don't know the reason.
yeah. Why did you go to Toru too? Oh.
I've seen a lot of posts
Training.
on Facebook. It's a
So,
lot of posts on
not so much for the
Facebook.
medical, director, I mean, there's a couple other things that I wanted to bring out. I don't know my job. I don't have my job description. I thought I did, but I don't really know because with this typhoon, we added hours, and I thought the medical director should have been involved in that discussion, and I was not. I did not find out that there was extra hours until already was decided. And I don't even know if the board knew about the extra hours.
No, I don't.
Okay, so I think
I
we have
knew
to
that they
include
weren't
the com-
gonna close north because of the power problem.
No. I'm not talking about that. I'm talking that we were told we needed to add morning hours, 6 to 8, evening hours, 5 to 7. Okay? I really don't know who made that decision. I think I should have been involved in that decision-making process, and I wasn't. So that's why I'm asking, what is my job description?
So Dr.
Oh, wait, I got a lot of stuff I gotta get off my chest.
Let
Okay?
it,
So,
Let it out.
so what I did, actually, I looked at our usage for the 6 to 8. This is how many patients we saw 6 to 8. And the problem is, some of these patients that come in depend on mass transit.
yes.
What time does mass transit open?
5.
They open at 5?
No, in the morning?
Yeah, they pick up the hospital at 5:30.
But they don't do the CHCs.
Yeah.
Not
That's
for
the
in
problem.
a run, not for in a run.
No, I didn't, I said.
That's what I'm
When
saying.
you mentioned 5 o'clock in
No,
the morning.
that's what time they open, they didn't, I didn't say what time they come to in the line.
That's what time they operate.
So we didn't, I thought I was told it was 8 o'clock, actually. So I was going, why are we opening the clinic at 6 when it's at 8 that they, because if they start at 8, the earliest that they can come is 9. So when in the morning, the earliest that we see patients are the ones that are scheduled to come in at 8 o'clock. There's been no patients before that. In the afternoon, what they've been doing, they've seen some patients in the afternoon, but it's not because of the typhoon situation. It's because, I had tested positive and I need to see. So they were making appointments and they said, well, we're having some physicians, and that's how it got filled, the evening clinic. So I think, like I said, I don't think this decision was made with the appropriate people, because I know I was not involved at all. And that's kind of why I'm asking, what is my job description? Am I supposed to be involved in this kind of, about a year ago, I didn't know I was supposed to come to these board meetings. When these board meetings were happening, I didn't even know that there was board meetings until I went to office to look for Darlene, and Darlene's at the board meeting. I go, what board meeting? Am I supposed to be going to its board meetings? And he said, yes. So why wasn't I told? So that's what I want to get off my chest, is that, what is my job? How am I going to do my job if I don't know what I'm supposed to be involved in?
Madam Chair, please answer him.
Wait.
Can you let him finish, Mr. Mello?
I'm also supposedly Chief Medical Officer for Public Health. And I don't know what I'm supposed to do with that. I do know that, and I complained to Kat already about this. Kat and Patrick went out to the different sites where they had the people that got displaced from the storm to identify medical needs, and I go,
No, Dr. Bob, just for correction. We went to the tier 1 shelters because we are asked requesting from the shelter manager if they will be able, once the shelterees come in, be able to identify if they have any medical condition or disease. That's it. We did not do an assessment, Dr. Bob. It's just a form because it's a, no, Doc.
Yeah.
Of course, we will, if it's a health assessment, we will engage you, which we did when they were still trying to identify a tier 2 shelter. So it's taking a while. That's why the nurses started to do the health assessment at tier 1, and we have immediately, that's why we created the group chat, we included you, so for your awareness immediately, and that's
And
what.
part of this is because, like, if you remember Malwar, we had that fiasco with the Red Cross. where
Yes,
the public
I was
health was supposed-
informed, I was not
Yeah,
part
they-
of
there was an
Mawar.
outbreak. The mayor at that time told a clinic, not public health, told the clinic came, and then they came on TV saying public health is not doing the job. And then when we read it in the newspaper, we sent a team to the Red Cross Center, and they were told they had no business here, get lost. You have no jurisdiction. The next day, then they talked to the head of the Red Cross department, and then they were saying, oh yeah, we do need help. And so they called me and said, can you come in with the meeting with Red Cross? And I said, well, my first response was, am I gonna get kicked out? Because that's what public health was done. They got kicked out. They said they had no jurisdiction. So we know this is a thing that needs to happen. So the next typhoon or storm, obviously we can't do it for earthquakes because the earthquakes happen without us knowing ahead of time. But we should have in plan about what to do with the storm, with the centers where they have to displace citizens, how to make sure that, because this is not the first time we had the problem with the water at the north. We waited, 4 or 5 days because the PO had to be generated, then given out. We should have in place a meeting saying, okay, we might need a PO for water. Let's get the PO now. If we don't need it, we don't use it. If we do need it, we already have the PO before the storm hits. This is our third storm, and I don't think we've done any of that before.
So Dr. Bob, regarding for the PO or the Dillon ticket for that in preparation for the North, we did put that in already by our representative EOC, even before Core 2.
Before the storm.
Before the storm, Core 2. And then I take responsibility. I did recommended the early opening of 6 a.m. to 8 a.m. That was my recommendation with Sherma. My apologies, I did not personally reach out to you on that to
On the
validate.
board. You should have given the information to the board.
So that time we were in public health emergency, we needed to do an operational.
I know, but
So
when was the
here-
when was the communication to the
So,
board
yes.
about this?
So you're correct, doctor, but at the same time, you remember you were off island.
No, I wasn't off island. And even if I
was-
was off island, Dr. Marquez was on island.
Yes.
I
I was
had an appointment,
communicating
but I
with
was
Dr.
on
Marquez.
island. I came in 2 days before the storm hit.
So when I was communicating with Dr. Marquez, she did not inform me that you were on island. She was, because I asked her who's going to cover, and she gave me a schedule for coverage.
Mhm.
Not at all did she say, oh, Dr. Bob is already on island. So I was communicating with her. I think moving forward, we just have to have a clear communication on when we're on island and when we're available.
Okay.
Yeah.
The other thing is that when we are in Core 2, we can only use our full-time employees.
That's right.
So
Because of the
CHE
contract.
has 4 full-time providers. 1 internal medicine, Dr. Polino, 1 family practice, Dr. Dombrowski, 1 nurse midwife, which we shouldn't be using for that, and then 1 nurse practitioner who was off island at the time. So basically, we were down to 2 people to supply the emergency needs for the clinic. The opening from 6 to 8 and 5 to 7, we could not use part-timers if they exceeded the hours. So what that meant was, if I'm coming in at 6 to 8, that meant one of my clinics was, instead of 8 to 5, it's only going to be 8 to 3. And it didn't make sense because the 3 to 5, we already knew I was going to be there and they were scheduling patients. So again, we only had 2 full-timers to supply all that need, because they're the only ones that can do get overtime. Because the part-timers are not, they're only allowed to do the amount of hours that they're supposed to do per their contract.
So Dr. Bob, we were in communication with the CDC legal team even before the disaster. And we had a meeting this morning. We asked that assistance from them if they could, help us drafting an addendum for the part-time healthcare provider contract. So hopefully we will be able to address that, especially during disaster, that they will still be able to provide service and be paid overtime because it's disaster. We have to
With
to
COVID, we
attend.
weren't paid overtime.
Hmm?
With COVID, I was only a part-timer, but I was doing about 80 hours a week and getting paid for it with the COVID. So I'm not too sure exactly what was different with COVID and with natural disasters. But I was doing,
funding source.
Yeah.
More
Because in COVID,
Yeah,
the federal
that's
government
true.
paid,
okay,
and the local, it's the local that pays, and the money is the difference, or where the funding source is the difference.
Yeah.
There should be an SOP,
Mhm.
right?
Yes.
Okay.
That should be drafted so that we are all in agreement on what
And
happens.
Kat's working on it already. Kat's working on it.
Okay.
Right, Kat?
I wanted to
Yes,
give an
we
update
are.
on the
She's working on
lab.
it.
The lab, again, 8 to 5 Northern, and they're actually have their reagents. They're able to do CBCs, UA, and wet mount. They're not able to do chemistries because they need a machine.
And we got problem on the lab.
Wait. In the south, it's only 8 to 12. They're CLIA waived, so they can go there, draw blood, but they're not allowed to do any of these labs that they're up in the north. In order for the south to get the same, be in the same situation, we need to purchase a machine or have a contract with the people that are providing contract with the north to do that to the south. So that, because we do have enough people to do both the north and the south. But right now, the south is only 8 to 12 because they're CLIA waived, they can only draw. They cannot run any of those labs that the north can. And if we want to expand that, we need to expand the contract with I forget what company it's.
We will
Yes.
check on that, Dr. Bob, with Dr. Basiti on how can Southern will have the same
They-
laboratory
need a
services as the
contract.
North. Yes.
They need a contract with the people that are doing the lab in the north. There's and they are the ones that actually check the machines and make sure everything's running smoothly with the supplies. But in the south, we don't have that contract. That's why they're CLIA waived, because they're just able to draw blood. And they only can do it in the morning because then they have to take the blood that they drew up to the north to have these things run or DLS run. And if we want to do other labs, then we need to also put in a contract saying we want to do chemistries. Because right now, those 3 labs are the only things that the north can run, and they can run 8 to 5. South just needs the blood, it's just drawing up blood. But they are getting their supplies.
Yes. Thank you, Dr. Bob.
And let's see what else. Oh, so once Dr. Duenas comes in, I think we'll be better able to supply services, but we still need nurses. We
Yes.
still need NAs. We still need medical records because it's like a bottleneck. We may have enough providers, but we don't have enough support staff for those providers. And if we want to make sure that we run our clinic the way it should be run, we need to make sure that we have support staff for these providers to be able to operate at their efficiency best.
Dr. Bob, I know we have a continuous recruitment for a community health nurse supervisor that opened up since last year, but no one is applying. There's also, I think, recruitment for a licensed practical nurse. But I will going to verify if that is CHC funded or MCH funded. But we can always, provide assistance between the 2 bureaus.
Thank you.
Thank you, Dr. Bob.
Okay.
The question I have for you is that there is a person went to go to the lab recommended by Dr. Chang. Dr. Chang, and they refused this person to get lab tests. I mean, to go through the process of lab.
To be honest, I don't know anything.
So
about
they
it.
send this person to Manila. Why?
I don't know. I've never heard of it.
Well, you're hearing it now.
I
Okay,
know.
Mr. Meno, maybe, like Dr. Bob said, there's certain things that they can't do in the south. And if they send them to Manila,
Not like he's saying it.
because there is a DLS in Manila, at the AMC.
So can we clear this as to what he's requesting?
So again,
What's the situation?
The lab can only do a CBC, they can only do, UA. If it's chemistry, they cannot do that because we don't have the.
The machine, yeah.
So it could be something.
Or,
that-
Or Dr. Meno, the lab
Mr.
request.
Meno,
Ay,
Mr.
Dr.
Meno.
Meno, Mr. Meno, sorry.
Mr. Meno.
Mr. Meno, or
Long
Mr.
time before I
Meno,
get doctor.
By efficient.
Okay, come on, guys.
or Mr. Meno, maybe the request, the lab request of Dr. Chang, we don't have the specimen
Yeah.
bottle at that time. Because we can do extraction and then we will just, deliver it to DLS together with our
No,
doctor's
this
request.
person
but
came to me and I said, I don't know, I
Yes,
cannot
that's why
answer you.
We need
That
to,
they send you, they refuse to, go through the process to the lab. And I said, where's your paper? They send me to, Manila.
so we will check on that, what
Something in Manila?
happened, why,
Yeah,
Manila.
because
Oh,
there's
yes.
DLS in Manila, yeah. We will check on that, Mr. Meno, what
Okay,
happened to
please.
that case.
They open at
Most
6,
probably,
Yeah.
the lab request is we don't have the specimen container
What the lady said is this. The lab will not take my lab that is required because his name is not there. Because his name is not there.
Okay,
On the
maybe on the slip. So we
Yeah.
don't know what it is, but like I said,
Still, the
Even-
problem is we have to clear those things out.
yeah.
So if we can get the name of that.
Yes,
Mr.
yes.
Meno, we'll call the patient, Mr. Meno.
Yes,
Give us the name and the contact
Yeah.
information.
I will give you the name and the contact. Yeah.
Thank you.
Okay? All right, moving along. We're gonna go to the treasurer's report first. Go ahead, Annie.
No, Madam Chair, please, I am sorry, I apologize to you, which I should not. You have not responded to his request.
They did, okay, what response?
He asking,
Okay, Mr. Meadow, Dr. Bob, the CPHO and
Yes.
Shermalyn
We're talking.
did talk to you and they did say that they were the ones that made the decision, not the board.
Right.
Okay, the only thing that I know about extending hours is when we talked about the southern hours where we're gonna be opening alternating weekends, okay? CPHO, you remember that, right?
Yes, yes.
But as far as the 6 a.m. to 8 a.m. and the 6 p.m. to 8 p.m.,
5 to
we
7.
didn't know about that. And that decision was made because of the emergency through the CPHO, not the board, okay?
and who made that decision?
The Department of Public Health, because of the
Okay.
typhoon emergency,
Okay,
okay? And that's just
And you can second
clarification.
it because you're a board member.
Yeah,
okay, he mentioned something about water. Okay, I'm recommending that we ask the mayor if there should be a typhoon again, to please bring water tank to the clinic, if it's possible.
you don't need that because our clinic has a backup water tank and a
Well,
backup generator for, we
Not
don't
the
need
north,
that.
not the north,
Yes, we do.
then why they said, they shut down because there's no water?
But Mr. Meno, you're correct. We don't have a water tank in the north. So that's why we did request.
So what
even
would
more.
happen if we give you water tank?
It
Oh,
has to
but
be
that's not
potable
in
water,
the- in
Mr.
the
Manning.
pipes, you have to go out there
Yes.
manually.
Yes, manually.
Oh, okay,
Yeah.
but
Yeah.
but yeah, I understand, but
So Mr. Menu, we did that in the last typhoon
Yeah.
in Sinlaco. It was a disaster.
Okay.
It was a
Cannot flush
disaster,
the
yeah.
toilet
Yeah.
and cannot,
Yeah.
Okay.
okay.
Clarification.
Yes, I got clarification.
Okay.
I'm satisfied with the clarification, and I'm satisfied with that in the future, things will be different.
Chair,
And they're working on the SOP right now.
Chair, I'd just like to say, so during public health emergencies, and the typhoon was a public health emergency, we make decisions and then we inform. So the same with HRSA. So I'm just informing them now what happened, and so with the board. So,
Okay. All right. Are you okay now, Mr. Meadow?
Yeah.
Okay. Dr. Bob, I'll talk to you on the side about the advertisements, okay? Because I did work with the PIO, like, the chief recommended for photography. I don't know why you were gonna put pictures of the providers, but I just wanted names and their position, their specialties. But they insisted on having photos, so
Yeah.
I did talk to the PIO last month to take the photos and do a layout, so she can send it to me and I will take care of them. Too
We can
bad.
post it in the south. and
We're gonna
post it in the
propose
north.
both in both
Yeah.
sides, okay? All right, thank you.
Because I think people
we'll
will
go
be
in-
surprised what we have.
Right, and who we have, right? Okay, so we'll go ahead and go to the treasurer's report before we'll switch it. Go ahead, Ann.
Treasurer's report, I last announced that we had, in the May 14 meeting, that we had $3,148.28. So the balance still remains the same. And in regards to the June meeting, I was absent, but we also had no quorum. So of course, the amount still remains the same. And no new checks have been written out, so balance remains the same. Okay. And before we can get that approved, I also wanted to announce that I did on my own take a class at GCC. It was a fundraising foundation, strategy, planning, and engagement. It was a 2.5-day class at GCC. And although, they talked about big numbers, 617.20 billion is raised just in fundraising money. That is a national statistic, so there wasn't much based on local statistics, but there were a few items, and I actually did that in the report, but I apologize, I forgot it. So my takeaway in that 617.20 billion that's raised annually from 2025 annually just on fundraising. I have a list of where that money goes to, where that money comes from. But my personal takeaway, and this is what I personally felt, is number one, shifting the mindset from begging for money when we do our fundraisers, shifting the mindset from begging to asking. And when asking, letting them believe that we're actually doing them a favor. And how are we doing them a favor? Number one, we make them feel good by donating to the cause. And number two, they're also offering two investment opportunities in the community. So that was something, because I know a lot of people don't want to ask. When they're in the fundraising committee, they do not want to be the one to ask. They'll do everything else but ask. So I really took that to heart. And then the second one is, and this is another one that personally hits me, when they say no. Okay, so when I get a no, I'm hurt, I'm angry, I'm whatever. So, it's like, well, forget them, that kind of attitude, right? So the takeaway that I really got from that is when they say no, don't take it personally. Okay, do not take it personally. Realize that maybe that day is not a good day for them. Maybe they actually met their budget for the annual donations. Whatever their reason is, but don't take it personally. So that as in all of that 2.5 days, I do have all the logistics, the technical, and the internal discussions and statistics. But those two were really hard hitting for me because that would actually prevent to go forward or stop. So that's it.
Yes, Peter.
If I can just add to what Trustee Annie was talking about. usually organizations, they have a
Budget.
budget and they have a fiscal year
Yeah,
planned out
for
for when,
donations, yeah.
where they can do donations. So maybe just to add to what Annie was saying is start early. Start early so you don't run the risk of hearing a no. Even though they may want to, they may not be able to.
Yeah.
So, but she makes valid points.
And you're absolutely right, because when we just did our Notre Dame Gala in October of 2025, October 1st was very late. Yeah, we started asking like mid-September. That was very, very late. So people who wanted as much to donate they already met their annual budget. So that's a lesson to learn and a date to remember.
Yeah,
Start early.
Guam starts early.
Right, start early. Okay.
And also, Miss Annie, if I may add to the board, like if there's some organization, nonprofit, I think like what other schools are also doing, we put like a plaque of their name at the community health center, so people would know that, hey, I'm part of that organization. We did donate it. We are part, like a piece of that, what we see at the community health center. The improvements, right?
Right.
Yes.
And I'll tell you, it's funny because when they said, yeah, board members should be donating anywhere from $1,000 to $5,000.
It's
So,
Yeah.
and I went and I had a personal conversation with the instructor. And of course, like I said, these were national statistics, but and not only are we a nonprofit, but we're also a government.
Yeah, we can do that.
Okay, so put your
Nick.
$1,000 in the middle of the table.
Donate. We can do that. Ask him to donate for us.
Okay.
So, like I said, I took this upon myself as the treasurer for our board, and I will be discussing with everybody. I will be getting everybody as a fund involved in the fundraising.
Well, we look
And-
forward to your
yes,
planning.
Yes, yes.
Because next month is CHC.
Yes.
I
We
mean,
should
it
do
doesn't have to
the-
be a massive one, but we'll just start a small.
Something healthy. Let's do Zumba. Go out and
Go
do a Zumba. Get your
Yeah.
tickets ready and let's do a Zumba fundraiser. Or a 5K.
I can talk to somebody after this, but okay, thank you. And we can get
Yeah. Okay, so do we have a motion to approve the treasurer's report?
I move.
Okay, motion by Sonia,
Second.
second by Ron and Daniel. All in favor, any discussions? No discussions, all in favor, say aye.
Alright.
Financial? Deb,
So the financial statement is in your packet.
yeah, because they can't hear you.
Oh, the financial statement is in the packet. Okay, and then at the top, it's just a summary of both program income and the grant revenue. As of yesterday, our available balance in program income is the 937,000. And for grants, it's 1.9. Okay, below that is the overall expenditures for the month of June.
Okay.
Okay. And then you have the billing information below that.
This is the
Benefit.
benefits, like the medical, retirement.
Personnel costs.
Personnel costs.
Together with salaries.
Okay, Deb, and this is the collections from okay, so we're billing is up to for the health set, for the northern, it's up to April?
No, billing is end of
End
January.
of January, okay, so we are behind.
Yeah.
And then southern is June.
June.
The program income available, how about the collection for the month of June? Like what we have collected, both from the insurance company and from the patient?
That's a
Because
total 83,275 for the month of June.
so this patient collection is collection from the patient themselves and the insurance, their
Yes.
insurances?
Yes.
Okay. And then for the claims process, because it's good you're noting down how many claims have been processed, meaning this has been sent out to the insurance companies,
Yes,
right?
Yeah.
And Medicaid. And for the North, it's 847.
Mhm.
How many claim specialists and eligibility specialists do you have at the North?
For billing,
Yes, for billing.
for North, one. A claim specialist, one. Eligibility specialist, one.
So a total of two staff who both process billing,
Yes.
correct?
Yeah.
And then for the South, how
We
many?
have one claim specialist, one eligibility specialist.
So we're only have a total of 4?
Yes.
Okay. So because I did the calculation we have 22 working days in June.
Mhm.
So we're processing claims approximately 38.5 claims a day. So if we have one ES who also does billing and the claim specialist who's also can do billing, it means the average is they're only doing 19 per day.
No, so in the north,
Mm-hmm.
we have one claims who also covers cashiers. So when the cashier's out because of medical reasons,
Mm-hmm.
that claims is covering the cashier. So she does. Then the other eligibility specialist, the additional,
Mhm.
does auditing.
So if the claim specialist is covering for the cashier, then no one is doing the billing because the ES is doing the audit.
No, there's one more, ES. One more. But she does auditing.
Yes. So
Yeah.
auditing. So once she audits, it means if she identify that, oh, they should have been paid denied, so she process and resubmit the claim.
Not the auditor.
Not the ES.
No.
Not the auditor. Okay, wait. You said there's one ES and one claim specialist at the North.
Two.
Two.
Two, yes.
But one ES is an auditor.
Yes.
So if the claim specialist is covering for the cashier, we still have one to process claims, billing,
Yes.
right?
Mhm.
But still, the average per day is about 19 for them to process. If it's only one, we can talk more about this and discuss because if the South too, it's very low. So it means you're only processing 21, an average of 21 per day. For two ES, for one ES and one claim specialist. And if there's less claims at the South, then maybe we can schedule them to assist at the North so we can bill more claims or process more claims to be billed at the North so we can catch up. Because anyway, South is already in June and then North is still in January.
And
Right?
If I can
So-
just, for your consideration. They're moving to zero-based budgeting for 27, right? Or 28. So you need to figure out how you're going to increase your benchmarks. So if you're doing 19 per person, let's say, then maybe it can be increased up to 25. I mean,
A
you know,
day, yes.
yeah, just to,
Okay?
Thank you.
So, yeah, it's kind of alarming because the northern is back more than 6 months of billing. So we're behind. And I know that I'm just asking Shermalyn, if we go into the EHR, is this gonna expedite not for the billing process? So there is one vacancy. I think we need to talk about filling that. Or another thing that we talked with the director about several months ago was maybe contracting the billing part,
Mhm.
right? that would probably be more cost effective, right?
Yeah.
So we'll take a look at, those options, okay? Thank you, Deb. Anything on any questions on the financial report? No questions? Do we have a motion to approve? Motion by Eileen to
Second.
approve the financial report, second by Mayor Allen. No other discussions, all in favor say aye.
Aye.
Okay, thank you so much. Okay, that's project and activities or events. We do have the back to school events at both the northern this weekend and southern next weekend.
Oh,
Okay,
not yet, July 18th.
this
this weekend?
Yes.
Yeah, July.
We're already July.
July.
It's almost Christmas.
Yeah.
This is
See, she's under
Sherman,
Yes.
Sherman, Mayor Charlotte was asking for the flyer for the South. Can we give him the flyer so he can,
put it on their chat room,
yes.
on their community.
So
chat.
we'll
And maybe
use
the
the
flyer for
It's the
north-
same
It's
flyer,
the same flyer.
Dr. Bob.
I know, but he doesn't have it.
Oh, okay.
Mayor-
Mayor.
Oh, Mayor,
Charlie.
okay, okay.
And then-
Mayor
and maybe
Tony.
you-
do have it
Just
on
as
our chat.
a, you could, for completeness sake, we can send it to Mayor Allen
Yeah.
for, and then, how can we get a hold of?
No, he's on our chat. He's on the Mayor Peter.
I know, but you know how it is.
Yeah,
We'll just give it to them personally so that they get the idea that we care for them.
yeah.
And then, how can we get a hold of, the Deputy Mayor?
He is, that's who I'm
I
talking
know, yeah,
about.
but maybe we can give him the
Yeah.
flyer
Yeah, okay.
personally.
I sent it actually to their, I'm still an admin on their Dedito chat. So
Okay,
I'll just post it there, okay? It's the community chat, yeah, okay?
Oh, but by the way, Mayor, we have one staff,
Claim specialist. Is she a claim specialist?
si Christine,
Yeah.
si Tina.
Tina.
Si Tina, she did the AAPC training,
Course.
she's already completed, so she's going to take the test to be certified.
Ah.
So
Tomorrow,
for the
her
billing.
schedule is
For the
tomorrow.
AAPC, so she's scheduled to take the
Okay.
test, so. we're
That
just-
make it
If she passed it,
Well, she's going to be certified.
certified professional biller, so it will add more credibility. So that's one of our goals for staff development as well, build their capacity and capability.
Capacity building, there you go.
Yes.
Okay.
one more thing
Yes.
I would like to,
Yes, Mayor.
we have two people that are gonna be we're supposed to go off island at the end of the month. For training in, what was it again?
For the conference.
Conference for the
For the
reproductive health.
reproductive.
Right.
Yes.
And everything's all paid for. But
They had a
because of-
scholarship.
But because of the typhoon, their travel was supposedly rescinded, right? Is that the way I understood it? All travel for public health employees suspended.
During the recovery.
Yes, during the recovery. But like I said, this is an important thing. It will help
And
develop
they're
our,
covered by Theo and Dr. Billy.
right, so we have,
And
Dr. Lee.
Yes.
So we have coverage for them and they're going, and what they're doing is will help with our programs or hopefully help with our program for female health. And this is at no cost at the end of the month.
July?
Yeah.
Yes. Deputy, Sherma have sent an email to you and the director yesterday about it, asking for reconsideration for their travel. Carlo and Dora, because this is the first this is part of the Title 10 grant covered, and their the learning that they will gain from this conference. And this conference is the only Title 10 accredited or credentialed conference for healthcare providers to improve reproductive health and sexual health, yes.
And so if they don't go, then the grant money that they're gonna be using will return back to where it's supposed. And it's like saying we don't want your money.
Never get it.
Okay, so there's,
Maybe if I can have the board give a recommendation that even though there is covered, since they are being covered already prior to the storm, and their full tuition, conference is all being paid for by federal monies, that they reconsider and allow them to go to this conference.
yeah, because there's no cost to the department.
I'll bring it up today.
Can you please?
Yes.
Oh, can we maybe have the board make a recommendation?
Okay, well, the deputy director's here.
I know, but
So, okay.
this is more
Okay,
official.
so then,
I move that we recommend the two
Providers.
providers be able to travel on their federally funded trip.
okay.
Second.
Okay, all in favor of making this recommendation, will say aye.
Aye.
Okay, we'll go ahead and,
Thank
well,
you.
our deputy director and our,
I
So
will be the toggle
you
for
be
the
the,
message.
you be the message, the carrier. The
Just in
carrier
case,
of-
because at our old age, I may forget.
Yeah.
Speak for yourself.
Was that,
How rude.
don't speak for you, that's.
I know.
You forgot to come. Yeah, so, you forgot what you were gonna
No,
say.
I admit when I forget.
Yeah. So, so that will go through your office anyways, right, through the financial system? Right, because they got it in on time, and.
They already got the ticket Mayor, since June. And everything has been confirmed, including everything completed in June.
Yeah, yeah, unfortunately, we can't control Mother Nature, right?
Yes.
Yeah, and the flights are open, so, the airport, everything's back up, okay? Okay, so that's the conference, and then anything else? The back to school is already gonna happen this weekend in the north. Okay, and then, of course, the ribbon cutting, we do have a list of things that, the ribbon cutting, the refreshments are taken care of already. It's already, just in this,
So we
Right.
have several outreaches,
August
maybe
2.
later on, after, once it's approved by management, with the farmers, group.
yeah,
Yes,
so,
we're just planning that.
did they finally, contact you?
Yes.
Keep
Yeah.
sharing your number.
They're the farmers team that takes care of the behavioral health.
Yeah.
Yes. So we're in contact with them and they're going to have an outreach and they invited the community health center and the public health, Division of Public Health Bureaus actually.
Good, because when I talk to the farmers, they really want,
Yes.
they really
Yes.
want. They say,
Yes.
where?
They're asking for a provider.
Yeah. Okay, good. Okay, and then the, what do you call that? What else is it? CHCs. Okay, we did get the sample of the, CFO position equipment, I mean, the description. And so please, if you have, any, recommendations, let us know, because once it's finalized with the position description, we'll go ahead and send out the performance evaluation, okay? Because
Mayor,
you're
just to clarify, so the CFO, position description and the CEO,
Oh, yeah.
performance evaluation, I sent two.
Mhm.
One was what was used during Miss Linda's time, and one from other. One
Another
was-
health center.
Yes, other health center that's approved by NAC.
Yeah. Okay,
Sorry, I have emergency.
okay.
I may be excused.
Okay.
Love you all.
Thanks. And then the CEO position, okay? Also, we did, 2 months ago, I also sent out the bylaws and so please review that. We really do need to vote on that. Because then strategic plans, if there's any adjusted strategic planning, not the policies. If there's any adjusted policies that we need to review, please send it to me, and then we'll get it to the board members so that we can have subcommittee meetings to go over it and so we can vote on it here. Okay, for
But
the next
reminder
Mayor,
for
yes.
the slide, is that the
The
sliding?
sliding field.
I think you have the original from the last.
Yes, yeah, and that was the reason why we couldn't vote for it, right?
Yeah, but I think they reviewed it.
Yeah, we
since
did
March.
review it since March, so do we have an approval for the sliding fee? The sliding fees, okay, there's
And I
motion
second
by
that motion.
Ron and second by Mr. Meno to approve the sliding fee scale as presented. Okay, all in favor, say aye.
Aye.
Okay, opposed?
May,
Okay,
sorry.
all right, so that carries, so that is approved now, yes.
Going back to the bylaws, if I may recommend, Mayor, because you're reviewing it, it was shared with me by Sherma as well of some additions that you have added or the members have also added. Just be reminded that it has to be in general. Don't be specific because if there would be changes that will impact that specific regulations that you included in the bylaw, then we have to amend it again.
Yeah.
Like example, there would be a change regulations in the federal side
Well, yeah.
in the next 6 months, then we have to change it again.
And that's one of the things with the bylaws, just like we did with the
With the
the-
bill for the,
also the as
CHC
well as the
autonomy,
co-applicant agreement,
yes,
where you cannot cite HRSA's requirements because that changes.
yes,
The policies and issues change every year, right?
yes.
They get amended. So we just refer to
Mhm.
the current policies and issues that are standing with HRSA, right?
Yes.
Okay.
Thank
All right,
you.
so anything else? Do we have, next meeting is scheduled for August.
August 20.
August 20th. Is everybody going to be here? Okay,
We can use the conference room in the Northern Clinic. We already cleared it.
oh. Okay, it's nice.
Why August 20?
Okay. That's the third Thursday of the month.
I'm not gonna be here.
Where are you going? Okay, all right, so August 20th is gonna be at the Northern. This is nice one. How did you get this?
Oh, and with our partnership with Cedars, because he submitted the grant application with them.
We were working, it so happened, Mayor, when I informed you, when you posted about our meeting for the day last week, I have shared, right, that Hessler has no power, so it's down and we don't know how long it would take. It so happened, Sherma was with our
Here.
partner here and she immediately asked, can we use? So that's why we were able to get the
But this is a nice place for Central, right?
Where's the meeting gonna be August 20?
Where are you gonna be and we'll have it there? California, no.
California?
It'll be at the Northern Health Center, okay? Yeah, all right, okay, the Northern Health Center, August 20th, and at 10 o'clock? 10 a.m., you okay? Okay, we'll see you then, and then, do I have a motion to adjourn?
One more.
Okay, one more?
I'd like to thank everyone for the journey serving in this board. This will be my last day.
What?
Thank you. It's really encouraging to see that people are still fighting for the needs of the people. Thank you for your service.
Where you going?
I'm retired. Oh, thank you, everyone.
Thank you, Mr.
Thank you, Toronto. Okay, so there's a motion to adjourn. Do I have a motion to adjourn? Okay.
Motion to adjourn. Second.
Okay, there's a motion by Sonia to adjourn and second by Jen. All in favor, say aye.
Aye.
Okay, thank you so much.
You wanted me to go to what meeting again?
Oh, the CMS.
So make sure you tell, what day is this?
July 29th.
No, I know,
Wednesday.
Wednesday. So